Welcome to the 418th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today, I welcome traffic collision experts Michael Grivna and Yassin Jamal Yassin to talk about their new research on collisions and the pandemic. Just a reminder, you can usually catch COVID calls live on weekdays at 7 p.m. Eastern Time. Just go to the COVID Calls YouTube channel to watch. This is a special COVID Calls episode at 5 p.m. Korea time. You can hear COVID Calls anytime, recorded as podcasts on iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. And please do help spread the word. Send suggestions for future guests, and as always, please feel free to suggest yourself as a future guest. According to the Johns Hopkins University Coronavirus Resource Center, as of February 18, 2022, the United Arab Emirates reports 2,290 deaths from COVID-19. Saudi Arabia reports 8,978, and the nation of Sweden reports 16,768 deaths from COVID-19. I've been reading an obituary or a story of advocacy for those impacted by the pandemic, and I'd like to continue that now. The headline is Dennis Smith, firefighter who wrote bestsellers, dies at 81. This was written by Sam Roberts, published January 23rd, 2022 in the New York Times. Dennis Smith, a former teenage hellion and high school dropout who transformed himself into a famed New York City firefighter, a gritty, best-selling author, and a leading guardian of the safety of his colleagues and the public, died on Friday in Venice, Florida. This is Friday in late January of 2022. In Venice, Florida, he was 81. His death in a hospital was caused by complications of COVID-19, his son Sean Smith said. Mr. Smith was headed for jail as a juvenile delinquent when a sympathetic judge offered him an alternative: join the military. He enlisted in the Air Force, returned to New York 3 years later, and joined the fire department. While earning bachelor's and master's degrees at night, his literary career began when a magazine editor read an erudite letter by Mr. Smith published in the New York Times Book Review, disputing the author Joyce Carol Oates' characterization of William Butler Yeats as a universal poet rather than primarily an Irish one. The editor was stunned to discover the letter was signed by a Dennis E. Smith, who identified himself not as a literary critic or public intellectual, but as a Bronx fireman. The editor's intervention helped lead to a contract for the first of 16 books. Report from Engine Company 82, published in 1972, was a chronicle of the city's busiest firehouse. The book sold some 3 million copies, ennobled Mr. Smith as a champion of his profession, and inspired countless men and women to become firefighters. One of Mr. Smith's books focused on the work of firefighters after the attack on the World Trade Center in 2001. His report from Ground Zero, the story of the rescue efforts at the World Trade Center, was published in 2002 and was at that time number 2 on the New York Times bestsellers list. Mr. Smith was a Renaissance firefighter. He played 8 musical instruments, founded Firehouse Magazine in 1976, was the founding chairman of the New York City Fire Museum, and was instrumental in converting the Engine Company 30 firehouse in Soho as its site. He also served as the president and chairman of the Kips Bay Boys and Girls Club, which moved from Manhattan to the South Bronx, and was the chairman of the New York Academy of Art. Dennis Edward Smith was born on September 9th, 1940, in the Bedford-Stuyvesant section of Brooklyn. He was raised in the East 50s of Manhattan when it was an Irish and Italian neighborhood that inspired Sidney Kingsley's play Dead End. His father, John, a Scottish immigrant, was committed to an asylum when Dennis was only 2 years old. His mother, Mary Hogan Smith, was a telephone operator and took in laundry and cleaned apartments on nearby Sutton Place to support her 2 sons when the family went on welfare. His mother was a disciplinarian who instilled in Dennis a love of books. He attended parochial schools, where, as a profile in the Times put it, When you were poor and Irish and growing up on the East Side in the 1950s, the nuns never told you to become a doctor or a lawyer, president of the United States, perhaps, but if not then a policeman or a fireman. He wrote about his childhood in the book A Song for Mary, an Irish American Memory, which was published in 1999. Mr. Smith served as an Air Force radar operator in Nevada, returned and joined the fire department in 1963, and he was assigned to a Queens firehouse in 1966, transferred to the Engine Company 82 in Morrisania when the Bronx was burning. He later moved with his family to suburban Orange County, New York. Deciding that he might eventually teach at a community college, he earned a bachelor's degree in English from New York University in 1970 and a master's in communication from New York University 2 years later. While he was still a part-time student working full-time as a firefighter, he wrote the aforementioned letter to the New York Times Book Review. Please remember, Mr. Smith wrote, that the poet, as evidenced by his writings, was Irish first. Through circuitous routes, he was contacted by an editor at McCall's magazine, was featured in a New Yorker interview, was commissioned to write an article for True magazine, and received a $30,000 advance for his book on Engine Company 82. His marriage to Patricia Kearney in 1962 ended in divorce. In addition to their son, Sean, he's survived by two other sons, Brendan and Dennis, two daughters, Deidre Smith-Wisniewski and Aislinn Falzerano, and 11 grandchildren. He remained with the department until 1981, returning as a volunteer after the World Trade Center attack in 2001, where he worked for months on the cleanup. He helped retrieve the body of the son of a fellow firefighter, Lee Ielpi, that December. He later developed cancer and chronic obstructive pulmonary disease, which his family attributed to dust inhaled at the site. In a Times Opinion essay in 1971, Mr. Smith recalled his ebullience at the prospect of becoming a firefighter. I would play to the cheers of excited hordes, climbing ladders, pulling hose, and saving children from the waltz of the hot masked devil, he wrote. I paused and fed the fires of my ego. Tearful mothers would kiss me, editorial writers would extol me in lofty phrases, and mayors would pin ribbons to my breast. After 8 years, he wrote, the romantic visions had faded. I've climbed 1,000 ladders and crawled Indian fashion down as many halls into a deadly nightshade of smoke, he wrote. A whirling darkness of black poison, knowing all the while that the ceiling may fall or the floor collapse or a hidden explosive ignite. He recalled a tenement fire in which an 18-month-old girl died. The teary would-be rescuer, a fellow firefighter, sat by him on the stoop, holding the body and saying over and over, poor little thing, she never had a chance. To which Mr. Smith wrote, I wish now that each man who intends to file for the coming fireman's test could have seen the humanity, the sympathy, and the sadness of those eyes, for they explained why we fight fires. The obituary of Dennis Smith, who died at age 81 from COVID in January 2022. Okay, I'd like to turn to my conversation for today. Let me introduce my guest to you. Professor Michael Grivna is a leading expert in injury control and safety promotion. Professor Grivna's research includes topics related to childhood and adolescent injuries, school safety, traffic safety, baby walker injuries, child vehicle occupant protection, playground injuries, trauma registration, and other public health issues. He's collaborating as a consultant with various public health and preventive medicine institutions in the United Arab Emirates and abroad, including the Department of Health Abu Dhabi and the Dubai Health Authority. He played a leading role in activities of the European Child Safety Alliance and implementation of the World Health Organization's Safe Community Program. He's currently a mentor of young scientists in the World Health Organization Violence and Injury Prevention Mentorship Program. My second guest is Yassine Jamel Yassine. He holds a Bachelor's of Science degree in Environmental Health from Haramaya University, Ethiopia, and a Master's degree in Public Health from Addis Ababa University in Ethiopia. Also a Master's in Science and Environmental Science from King Fahd University of Petroleum and Minerals. He also holds a certificate in clinical research from the Harvard Medical School. He's a faculty member in the School of Public Health at the College of Health Sciences in the Mekelle University, Ethiopia, and is a third-year PhD student in the Institute of Public Health in the College of Medicine and Health Sciences, the United Arab Emirates University. Let me thank both of my guests, Michael Grivna and Yassine Jamal Yassine, for joining me today on COVID Calls. Good to see you both.
Good afternoon. Good afternoon, Scott.
Thank you. Good afternoon, Dr. Scott.
I'd like to start the way.
Invitation.
Yeah, absolutely. I've really been looking forward to this conversation and talking about this research. And let me start the way I generally do, just to find out where you're calling from and what the pandemic situation looks like there. And Michael, let me start with you on that.
I'm just coming from United Arab Emirates, from city of Al Ain. It is not so large city, around 700,000 people. For people maybe that are more familiar with Dubai or Abu Dhabi, so it is like approximately 1 hour drive from Abu Dhabi or Dubai. And here in Al Ain is based a major United Arab Emirates University. It is a federal government entity, academic institution, and the oldest institution in the country. I'm working at the College of Medicine at this Institute of Public Health. I'm director of the Institute of Public Health, and we are doing a lot of research and collaboration with the stakeholders, health authority, but also we are involved in the undergraduate and postgraduate education.
So I've really been eager to ask you what the situation is looking like there in the UAE, especially right now. I think the World Expo is still going on for another month, so UAE has been in the headlines. What's the pandemic situation been looking like there?
In some way, we are quite lucky in the United Arab Emirates, and we have, compared to other countries, quite a good situation. Low prevalence of the incidence of the COVID positive cases. Daily average now it is around 900 cases, and in 10 million people population, around 10 million people, it is 9.6 million people. It is quite low. We had some peak in January, around 9th of January, which was reached to 20,000-30,000 per day, but now we are lowered. Of course, it is related to the all the activities of the government and pandemic related combating pandemic. We have, I think, highest vaccination rate in the world, around 96-97%, and of course, quite strict measures and fast measures in the beginning of the pandemic. So I think all was like really quite beneficial. Now, of course, the organization of the healthcare is quite interesting because it is federal country. It is 7 emirates, and every emirate has a little bit different, maybe differences in the healthcare, in the legislation, regulation, and so on. And Dubai has own health authority, the Dubai Health Authority. Abu Dhabi, for example, has Abu Dhabi Department of Health and Abu Dhabi Public Health Center, and some other emirates are under Ministry of Health and Prevention. So there are differences a little bit, and even in the measures, pandemic measures, were a little bit differences. So, for example, in Abu Dhabi, there were in sometimes a little bit more stricter measures than Dubai. And of course, it is related to the different issues, and specifically with the Expo, because Dubai didn't want to limit too much, the tourists coming to Dubai and to visit the Expo. But still, even the Expo is like really already in the quite long time. It will finish in 2 months, in the end of March. Still, there are quite efficient measures. And it is related to the influx of the tourists, to the checking the COVID status, and even the entering the Expo facility. The people have to show some PCR test, which is not older than 48 hours. So there are still measures in the place to preserve even tourists from getting the COVID in the place.
Well, thank you for that overview. 96% vaccination rate is astounding. What do you attribute that to?
I think, of course, there was like quite a response or a governmental decision to do it and to fast approach to the vaccination. The structure was in place and quite a fast development of the logistics. So we were a country which, the country bought the vaccines. In first stage, of course, it was the Chinese Sinopharm, and then later some other countries, Pfizer and Sputnik and some other. But logistically, they organized the vaccination in very fast manner and very good manner. So it was available for the population to be vaccinated, and it was organized very well and very fast. So the process of the vaccination was very fast. So this was very, I think, useful. And of course, we are speaking about already fully vaccinated, so with even the booster vaccine, second and third dose. So it is really quite going very fast. Now the country is moving to the vaccinating the children from 5 to 12. Of course, there are debates if it is sufficient or needed or whatever, but still there is the process which is really quite supported by the government. Of course, UAE is more affluent and the country who could afford this, and I think we are really lucky. But they are also involved in some involved in some welfare and helping to other countries. There is a quite big hub in the Dubai to help the other countries in the delivering of vaccines or sending vaccines and so on.
There's one other, Yassine, I'll come to you in just one second, but there was one other nuance on this I wanted to ask you about, Michael. I know in recent years, the UAE has had a pretty large guest worker population, and those are workers coming from South Asia, also coming from the West, from the UK, from Australia, from the United States. Help me understand a little bit what that means in terms of pandemic control and vaccination.
This is very interesting and very smart question. In fact, in the UAE, we have 85% expatriate community. Only 15% are UAE national, local citizens. And it is really quite have the influence on the healthcare system, on the delivery, but also in the information system. How to do for example, awareness campaign, because you need to use different languages to reach all these, minorities or some other subpopulations. And in fact, it was quite interesting. In the first epidemiological studies, it was clear that there was quite high transmission among the immigrants in the, workers' camps and so on. So it was like quite, because they are living in quite close proximity compared to some other UAE nationals or something like this in the bigger houses and bigger space. So there was a much higher and prevalence in transmission. So in the beginning of the pandemic, this was very interesting. Of course, this is issue which is government should somehow take into account in the delivery of the healthcare services. Of course, there is different system for the insurance system, but all the workers should be covered. So this is really very important issue, and I think it is the accounting and providing the services for all population in the UAE.
Okay, thank you for that. It's really interesting. I didn't realize it was 85%. That's really important, and what a crucial area for public health delivery in the UAE. Yassine, happy to bring you in now, and let me ask you the same question as we start. Just where are you calling from, and what's the pandemic situation looking like there?
Thank you, Doctor. Actually, I just came end of December 2021. So I don't have adequate information regarding this pandemic situation in Sweden, but I can add on what Professor Michael said about the pandemic situation in UAE. Just to add a few, the first case of COVID-19 was, confirmed in UAE on January 29, 2020. And early measures were, adopted by the government since early February 2020. So the measures are very effective and with high penalties for the violators. So if you are, for example, if you are not wearing the face mask, the fines are, much higher, and it will reach, around 3,000 UAE dirhams. So all those measures, make the measures to be effective and highly organized by the government. The other important thing all the PCR tests and the vaccinations, they are given in a more accessible way. For example, for students and faculty members and other staffs, it will be given in the university or student hostels. So it will be easy for us just to go and get the vaccination and PCR test immediately. Again, they will send us the notification email or SMS messages, and there is also Al Husn app, so you can access all your test data, the results, everything. For example, if you get infected with positive PCR test, the ambulance with emergency team will come to your place, and then they will take you to the quarantine or isolation area. So it is very effective, and the measures, started early. The other important thing, they also started the national disinfection program. Other measures such as closure of schools or universities, social distancing, even they banned the congregational prayers anytime and during the Friday. So all this in combination, makes more effective in addressing the pandemic in UAE. Although there are some aspects to be considered.
Yassine, let me just follow up with one question about that, and I'm curious what the role of the Islamic leadership, mosques, people wanting to gather in those kinds of settings. What was the role there of religious leaders in terms of getting out the kind of public health messages?
Actually, there is no speech or preacher on that, but the government gives them directions. So when you go to for example, to the masjid, they will provide us a piece of papers or a plastic material just to pray by keeping 2 meter distance with social distancing. And we are not allowed to go without face mask. Otherwise, the security persons will not allow us to enter. The most important thing, till recently, I think Professor Michael will help me on this, they will not allow even congregational prayers at all for a long period of time. So individuals were, praying at their homes independently. So it's recently allowed. I think it's end of 2021, I think. So after that, it's become we can go with our own math. So we can pray on that, but still we will keep the social distancing. And they provide also hand sanitizer. So when you go, just we disinfect our hands, and then we will use our own mat, and we will keep the social distancing. So it was very effective, and there is no any preach by the religious leaders about how to prevent, but it is already disseminated, and the directions were given by the government, so it will be effectively implemented. Otherwise, you will be even fined, because they will call the security guys to those responsible bodies who are authorized by the higher body. So they will come and they will take you to the police. So it is very effective.
Well, thank you both for that. I want to talk about your research, but I couldn't miss the opportunity to get these insights from the UAE, the first guests I've had to really find out how the pandemic has been managed there. I would just want to remind guests that I'm talking with Michael Gribna and Yassine Jamal Yassine today on COVID calls. And let's talk a bit about your research now. And Michael, let me start with you about this. You came into my consciousness when I came across a paper titled "The Global Impact of COVID-19 Pandemic on Road Traffic Collisions," which I thought was a really quite brilliant insight into, maybe an unexpected way in which this pandemic is affecting public health. So let's talk, and this is a long-standing area of your own research. Let's talk about how you came into this particular study.
In fact, it was in the line of the other studies what we did. We started immediately in the COVID pandemic to do some studies related to epidemiological issues and the prevalence, about the mental health among the different, study population, healthcare workers, medical students, and so on. And then we realized that there is some impact on some other like related activities in the life, and this related to the, for example, violence, injuries, and one of the area was the traffic related injuries. And we could expect that there will be some changes because of course there was the lockdown and there was different situation, environmental situation in the traffic and traffic volume and people using the cars or other means of transportation. So this was somehow motivation to do this study. And specifically we did two major studies, and Yasin was the main author. I think that he will speak more details about these studies. One was more on the global issue to assess, all the literature available and the different, factors in the different countries. And one was focusing more locally, and it is assessing really health hospitalizations in the trauma registry and how the traffic was affecting. So before a pandemic and during the pandemic, the changes and comparing. And the results were really quite interesting. But I will leave maybe Yasin to, speak more about the details. He was main author, so I think he could explain more about the study. So.
Yasin, that's great. Let me bring you in on this. And I think as we start, maybe you can help us understand just the overall context of how big a public health problem road traffic collisions are worldwide before the pandemic.
I'm as you have introduced, I'm a PhD student, and my PhD thesis topic is risk factors affecting the pattern and severity of road traffic collisions, the global and the UAE perspective. So I use for the global data the WHO World Health Organization Global Status Report on Road Safety, and I was assessing the risk factors based on the data on that specific reports. So far, the WHO published 3 papers as a global monitoring system in order to achieve the 50% reduction as set by the United Nations. So when I came up with that based on the interest, I had to read a lot of papers to understand the risk factors, but the WHO data missed some important factors such as environmental factors. It is not well described. So in this case, what we did with my professors, just we read actually, we published a paper on pedestrian death rate. It's a global study based on the WHO Global Status Report on Road Safety. So in that, it showed us high level of pedestrian and motorcycle mortality. It showed in 2016, road traffic collisions caused around 1.35 million deaths globally. Of this, around 51% was pedestrian and motorcycle mortality rates, which are equivalent to 23% of the global road traffic collisions or road traffic collision deaths are attributed to the pedestrian death, and 28% of this global deaths are motorcycle deaths. So in this case, we learned that it is more severe, and the burden of road traffic collision on vulnerable population is very high. So in order to make all the factors to be addressed, we have to look on the other aspects which are from the usual way on the environmental factors. So we understand that COVID-19 is one of the environmental factors that can affect the road traffic characteristics, such as traffic congestion, and it may also affect the traffic volume and traffic density, which will affect speed. So in this case, we read on May 21, 2020, a news was published by the BBC News, which states the impact of COVID-19. I mean, the effects of COVID-19 pandemic during the coronavirus pandemic in USA. So I received that message from Professor Michael, and I go through it. So in the beginning, we agreed to make it, a commentary paper. Later on, we discussed it again to promote it with Professor Fikri Abu Zidan to make it, a semi-review. And then later on, as I go through different sources, I collect a lot of published papers on scientific journals. And also I read media reports such as BBC, CNN, and other media outlets. And there are also some webinar discussions around the US and the Europe. So all this helped me, to organize it, and later on we make it to narrative review. So all this gives me an impression, and it will help me, to include one of the environmental as COVID-19 as one of the environmental factors affecting COVID-19 pandemic. So all this gives me an impression to go and read more on the literature and understand the environmental factor, how it affects the mobility, and how mobility affects the congestion, and then this congestion affects the other factors such as traffic lanes or increasing speed. Even also, it also affects, the law enforcement measures. So all this gives me an opportunity to go and to write the paper. I think Professor will add on this.
Yeah, maybe I could only add a couple of the information. I think we would expect that because of the lockdowns, that there will be a decrease in the road traffic crashes, and somehow we would like to really have some evidence about this. So it showed that there was decrease in the road traffic crashes, number of the road traffic crashes, and also some like even the mortality influence and hospitalizations and so on. But what was really interesting, that what Yasin was explaining, that there was, because there were less cars on the street, there was the speeding, like higher speed. And of course, of those who were like having the traffic crash, that it was more severe, and even these traffic crashes were more deadly. One specific result, which was very interesting also, what Yasin was mentioning, is some local influences. And here, because lockdowns, the people started to order more food from the outlet online. And because there were like delivery on the motorcycles, so we see the much higher prevalence of the motorcycle related crashes and the injuries related to the motorcycle crashes. So there was quite interesting, evidence of the how the COVID pandemic was influencing. For us, of course, the traffic-related, somehow injuries, it is really major issue in the UAE. And it is when I arrived in 2003, the prevalence from or mortality related to road traffic crashes was highest in the world. It was 32 per 100,000. And it was really incredible. I was surprised, in fact, and it was really many different risk factors and issues involved. Government started to provide some intersectoral intervention with the changing of the environment, changing of the road safety, like streets, lighting, speed measures, seat belts, somehow enforcement, and so on. And it was very successful. So it decreased to almost 4.5, around 5 per 100,000. So it was very successful in some ways, the intervention. Still, it is higher than, for example, in the UK, where it is around 4, or Sweden, it is around 2. So we have the much higher still mortality than those countries. But in the GCC countries, I think it was really very successful, and we have the lower mortality than in some neighboring countries. So the COVID pandemic was, of course, somehow influencing this, the environment in the traffic and the number of injuries. There is another issue, and it is because the healthcare system was somehow overwhelmed about COVID cases and treatment of the COVID cases. And now the ambulance system should be really very specific how to deliver, for example, injured patient from traffic injury to which hospital, because there were dedicated hospitals to the COVID, and some were treating, trauma centers to some other issues. So this was also influencing some, issues related to the traffic injuries.
There's so many fascinating insights there. I mean, just to underline one important thing that you said, from the majority of the countries that you looked at, that if I'm understanding correctly, the number of traffic deaths and injuries goes down because there's just fewer cars on the road. But with fewer cars on the road, those that are there traveling at higher velocity, and therefore the people who are engaged in accidents tend to have more serious injuries. So that's the sort of, I've got that part.
Yes.
Overall, right. There's a follow-up piece of this, which is highly relevant here in South Korea. I think it's relevant everywhere, but particularly here in South Korea, where in the earlier phase of the pandemic, people were relying on food delivery a great deal. Already a dangerous job. I mean, you would probably consider these essential workers. I'm not sure the category is yet generally extended to them, but Seoul would shut down if it didn't have food delivery during the pandemic. And it's a very dangerous job for these delivery drivers. Is that a pattern that you saw play out in the other countries that you looked at? You talked, Yassine, for example, about the importance of looking at motorcycle incidents and pedestrian accidents in this context.
Thank you, Professor. And this is very important and very interesting question. Actually, we did the global study, which is a review, and we also did a local study, which is based on the trauma registered data in our hospitals, in Al Ain Hospital and Tawam hospitals. So, for example, in our local study, it showed us clearly an increase in motorcycle mortality, and this is attributed to the food delivery. So it increased the accident, and it is similar to other countries. However, the overall road traffic mortality varies by country. It also varies by road user types. In some countries, motorcycle and cycling mortality increases, and other countries it decreases. For example, in case of UAE, most of the workers are expatriates, and they are allowed to work as just to cover their expenses. So they are driving, and they have, as you said, they have high risk of crashes, and the mortality increase. But when you compare with the locals, the UAE, most of them, they are government employees and they are allowed to work from home. So in this case, the mortality definitely decreases among UAE nationals compared to these expatriates. And those expatriates, most of them, they are motorcycle riders. So in this case, it increases. And this is mainly associated with the delivery system, food delivery system. They will go, even there are fascinating interviews that was done in Dubai by the experts. So some of the motorcycle riders say, we are busy and we are in hurry just to pick the food and to deliver to the customers. So in this case, if they delay, the customers will be upset, and the restaurant owners will be, taking some measures. So in this case, they are pressurized by both, and they drive in high speed, and they face crashes. So in this case, of course, it happens. Similarly, in Australia and other countries, the motorcycle mortality increased, but in others, it's also decreased. So it varies by country, by road type user, and by the between urban and rural, and so on. So all those factors should be taken into consideration in order to understand the overall skeleton of the COVID impact on road traffic collisions.
Let me just remind everyone that you're listening to COVID Calls, and I'm talking today to Yassine Jamal Yassine and Michael Grivna about their fascinating new research on road traffic collisions and public health in the pandemic. So a few countries were outliers in these studies, and maybe Michael, let me start with you on this. For example, you found the patterns that we were just talking about. The United States also went through a lockdown, but you found something a little different about the US, didn't you?
Yes.
As Yassine was mentioning, it was very interesting to see the differences between the countries. I think the reports were really different because in some countries there was in fact increase in the mortality related to the road traffic crashes and even the hospitalizations and so on. A couple of the countries, they have different issues, but we need to consider also the differences in the population structure, how many cars there are involved, mobility, use of the cars for the for the driving and so on. and the environmental factors. And it is like road designs, for example. Here in the UAE, even in a line, we have like between the roundabouts could be lines like 6 lanes of the lines. Okay, so 3 lines, which is really quite almost like highway type of the lines. And in this case, all the cars and even motorcycles are reaching quite high level of the speed. So on some, there are limitations and we are inside the city, but it is like 100 or 80, right? And so transfer of the kinetic energy, it is incredibly high, even in the minor crash for the motorcyclist, for example. So the consequences could be quite serious. In some countries where it is more crowded area, like for example in India, in some Asian countries where it is more crowded, so the cars or motorcycles or rickshaws, they cannot reach too high speed. So in this case, they could be collisions, but the consequences could be less severe than in the UAE. We have specifics even like in the structure of the cars. The most popular car among the people, it is SUV, and it is of course related to the popularity to go to the off-road and to the desert and so on. Especially UAE national families, local families are using SUV. And what is really different between SUV and sedan, it is different kinetic of the traffic crash. So sedan is more stable and the center of the gravity is much lower to the road, so they don't tend to roll over. SUV, because the center of the gravity is higher, they tend to roll over. And of course, if you don't have the seat-belted passengers, they tend to be ejected, and the consequences are incredibly serious. And we were showing this in previous studies with Professor Fikri Abu Zidan. Yasin was already mentioning Professor Fikri, and I need to mention him because he was very keen and really very important figure here in the UAE, establishing trauma registry and building the data source and a lot of research related to the different injuries, specifically of the traffic-related injuries. So he was very keen and very, the important figure to do for the epidemiological studies, risk and clinical studies related to the injuries. And we were showing in the previous studies that, the proportion of the rollovers or ejections, which much higher in the UAE compared to other countries. So this was very interesting. And of course, we have the different population structure. So we have a lot of UAE nationals who are, driving very early in the age. And, there is a lot of risk related to the driving behavior and, driving education or experience and so on. We don't have so much, for example, challenges as other countries related to the alcohol and drug use. There is some. It is still right. So we have like when we assess the traffic-related injuries hospital-based in a line, around 1% there related to the alcohol. The higher blood alcohol level. So in the other countries, of course, the alcohol or drugs are a much bigger risk factor than here in the UAE. Of course, there is this culture and religious influence and so on. So in this case, we are in some way lucky that this factor is not playing so major role as in some other countries.
Let me make sure that I acknowledge the full team for the study. You were just talking about the impact of the COVID-19 pandemic on road traffic collision injury patterns and severity in Al Ain City, United Arab Emirates. And that was, Yasin, you're the lead author on that, David Alao, and then Michael, you're also co-author, and Fikri M. Abu Zidan also. So that's your full team on this. And another piece of this, I just wanted to come back to, Yasin. Let me ask you about this. So the implications here, particularly during the worst part of the early pandemic, in terms of tantalizing details you were just talking about a few moments ago about the problem of allocating health resources. So where should ambulances go? And I'm thinking here of New York. I'm thinking here of Spain, of Italy, countries in those first few months, particularly, where we saw in the news this constant parade of ambulances moving day and night in dense urban areas where the collisions might not have always been the problem, but it was just the slowness of the traffic that was, people dying in ambulances. And I wonder what that means in terms of, you know, the traffic study you've been looking at. You know, my question, I guess, is how successful were, you know, EMS and 911 services, emergency medical services, in adapting to this problem that traffic accident victims need to go one place and maybe COVID victims need to go another. I hadn't thought about that problem until I read your work. What did you learn about that particular problem, Yassine?
Thank you, Doctor. It's also a very interesting question. Actually, during the COVID-19, there are resource mobilization, especially, you know, most of the resources of the hospitals, they are, you know, intended for COVID-19 patients, and they are not targeting, you know, other patients. For example, as you have mentioned, the traffic injured patients. So, in this case, even there are, you know, delayances in some cases. For example, in our hospital, when the traffic injured patients are coming to the hospital, they will stay for PCR test, and then it will take time. Then if they are negative, they will receive the treatment immediately. But if they are positive, they will delay and they will transfer to other hospitals because it is shifted. For example, in our city, there are two major trauma centers, Al Ain Hospital and Tawam Hospital. So during the COVID-19, the Tawam Hospital is only responsible for trauma patients. Al Ain is already, if I'm mistaken, Professor will help me. Al Ain Hospital is already designed for COVID-19 patients. So in this case, they will transport it, and it will even reduce the almost. Previously it was two hospitals, but now during the COVID-19 it becomes one. So in this case, there are reductions even on the number of services that will be provided to injured patients. Even from other countries, and trauma studies show that those resource allocations are, you know, more mobilized and more beds are, you know, allocated for those COVID patients who are at high risk of, you know, or high level of risk of death. So, I mean, the sickness or morbidity. So, in this case, there are resource reductions or resource. How can I say resource? You know, they get reduction in resources. So in this case, there might be deaths, you know.
Right.
Second, there might be delay in the output of the PCR test. For example, in our case, they will delay for certain hours. So in this case, if the patient is, you know, got injured and delayed for PCR result, he may die. So in this case, it affects us. But the good thing in our case, there was only 3 COVID-19 positive, three positive cases, and they survived it, and there was no death. So we are lucky in this case. But in other countries, due to the delay of the PCR test result, some patients might be, you know, died. But if it wasn't during the COVID-19, they will go directly for the treatment, and all the necessary measures might be, you know, done for them quickly, so their lives might be saved. So in this case, there might be different. The other important thing, I hope there should be, you know, monitoring by technology such as we can use, you know, drones to monitor the speed, so that we because, you know, speed is one of the major factors for the injury severity. So if you monitor by technology using drones, we can reduce the number of severity or the highly severely injured patients, and then we can also transport by helicopters. For example, UAE, they use helicopters as ambulance, and there are also other ambulance services for transporting this one. But in case of COVID-19, it will be very challenging. So my suggestion to address this is, you know, it will be better to monitor the speed using drones and other high-speed using speed cameras so that we can address them. Otherwise, it will be, a very challenging one, because, pandemics are, unprecedented, and you cannot predict them when will happen and occur. So in this case, it will be good if we use other technologies so that we can address them. The other important thing, the emergency medical service in the UAE is very organized. So those who are responsible for that, they can divide their services in transporting COVID-19 patients, and some of the ambulances for allocating for injured patients. Otherwise, if you ignore the road traffic aspect, and if you are focusing, we may face, a lot of deaths from the road. So in this case, it should be organized, and directions must be given. Thank you.
Just one thing that's on my mind, and I don't know if it comes out of any of the data you were able to look at. Michael, let me ask you about this, because you were pointing to the really critical importance of different sort of infrastructure cultures around the world when it comes to understanding, mortality and auto accidents. But I'm remembering that in places like where my family is from, in Texas, in the United States, people had to be in their cars to get their PCR tests, and they did a whole election in the United States in which an astoundingly large number of people voted through drive-by, mail drops. So we had a lot of services that became auto-based in the United States. And I wonder, do you have any sense if that also contributed maybe to a higher rate of accidents? I hadn't thought about this issue of people who are worried that they're sick and they have to take to their car to get the kind of medical intervention that they need.
I think you are right. We don't have any evidence or who was studying this issue, or at least I'm not aware of the study from the US. Maybe there is some. In the UAE, it was quite very well organized, even the information system and lockdown. So that means that the majority of the people stayed at home if the the industry or the trade was not necessary for them to go to the workforce. So it was in the beginning of pandemic, and this was really quite fast. So that means like all the measures were quite very well organized. What was really very specific in the UAE, I think that the UAE had the experience with previous pandemics, or maybe endemics, or maybe some like outbreaks. Like there was the MERS, and so there were some like the already the preparedness plan for some like if some pandemic will occur, or the bigger the outbreak will occur. So this was like really in the beginning very useful, because there was activation of the system which could respond to with the different measures. The majority, it was like really quite clear that the lockdown was decreasing the traffic, and the people were not using so much. There was a huge shift to use the online services, like educational, all the school education started to be the online. It was very fast somehow development of the online teaching measures because some schools were not even equipped with the technology and so on in universities, but they had to adjust. It was very challenging, of course, as in the other countries, that the parents, what to do with the kids if they cannot go to the school, how to deal with the supervision of the kids and so on. So this was like really many challenges. But also the online services, like delivery of the food, delivery of the medicine, even like the healthcare sector reacted with the telemedicine facilities. Or for example, for the chronic patients, they could cancel on the telemedicine on the video using the online system or PCs, and also delivery of the medicine was by the online delivery in some way. So in this case, they were limiting the people to go to primary healthcare centers, because they wanted to assure that even the chronic patients will receive sort of care and so on. So in this case here, we didn't see so big going outside for the needed to going for the shopping, for example. the government established very efficiently and very fast PCR centers. What you were mentioning, that the people had to go to take the PCR test, but it was very well organized. There was the application that you can order even time-wise, when you, in the time frame, where you can go and which PCR center you will choose, which is closer to your, your accommodation. So in a line, it was a couple of the centers, and people could really, check and the timing, choose the timing, that not to spend like 4 hours or 2 hours or whatever in the car, but they could really go there, take the test and leave in the time frame, for example, half an hour or 1 hour or whatever. So in this case, this service was very fastly developed. The construction of these PCR centers was built around the country very efficiently. Even the new hospitals, field hospitals they built, waiting for some wave of the hospitalized patient, which was in fact not completely needed, but the service was already, reacted to provision and, expecting that there will be need for the additional healthcare services.
We're almost up on time in our conversation today with Jamal Yassin and Michael Grivna about road traffic collisions and COVID-19. Yassin, you started us on a really interesting, area talking about the policy implications of this research that you've been doing. I'm thinking of some really interesting analogous work in environmental science. And it kind of goes like this. Nobody would wish for a pandemic to find out that you could actually reduce the amount of carbon going into the atmosphere if you had collective action, which in this case was people were not out. People, the traffic, driving, factories closing down. I mean, and I think of that as an interesting analog to the work you're doing. You would never want a pandemic to create the moment within which you can actually study what it looks like to get people off the road. But that is what happened. And so that's why one of the things I find your work so interesting. So you were talking about some of the policy interventions that you would recommend, Yassin, a moment ago. Anything else, policymakers, automakers, local police forces, people should be taking away from this research in terms of how to make driving safer when the pandemic is over?
Thank you, Prof. Thank you, Doctor. So this is also another very important question. In the first place, we have to document the lessons learned and the experience during the COVID-19 so that we can improve them in the future pandemics. The other important thing, as you said, no one wishes to occur any pandemic in the future. But there are can I say, there is a blessing in disguise in road traffic for the impact of COVID-19 on road traffic and the environmental pollution. It contributes a lot. It has a positive impact. For example, it reduces carbon emission or other greenhouse gases because it reduces the number of vehicles. At the same time, it also reduces the number of road traffic collisions. So in this case, we have to learn the good thing. And we have to also improve, for example, some of the policy implications that I suppose we can use online shopping. This will reduce, the number of public transportation and private cars or other trips. We can also use virtual learning so that we can reduce the number of transportation. For example, the number of students going every day will reduce. Even we can also work online from home. So we see these clear differences. The other important thing during the pandemic, we can provide telemedicine. So it may also reduce the number of congestion, even transportation systems. So the other important thing, we have to document all the resources that we have from different organizations, from police, universities, research institutions, or other stakeholders, so that we have to have a document, so that we can implement it, properly after the pandemic. The other important thing, most of our review are based on the urban reports. It misses data from rural and other developing countries. So we have to include all these things so that we will have an overall picture on the impact of COVID-19 on road traffic collisions in all settings. Otherwise, it will be incomplete. So in order to have a good look, we have to include future studies also, that from rural and from other countries, especially developing countries. So we miss a lot of data from many of the developing countries and many of the rural areas. Even in rural areas in developed country, we miss that one. So if we include all those things, we will have a good and complete data. So in road traffic, actually, even most of the law enforcement measures, even the requirements for driving license, some of them, they were not effective. In one of the reports that I have read during my review, in US, it becomes even less restricted. So those young individuals, they will register for driving license, and they will receive it, easily without a challenge. So in this case, some of the report says it increases because of the unexpressed driving experience by those young guys. At the same time, there is free lanes or empty lanes, so that they will be encouraged, to drive at high speed, and then they ended with a tragic outcome. So in this case, it should be very strict, and we have to install speed cameras. We have to deploy drones and helicopters in order to address all these things. So Professor will add on this, and thank you so much.
Only, I don't know if we have the time, only a couple of the sentences. I think it was really great what Yasin was mentioning. I think it is very important to study all the local influences. It is very difficult to do the global, somehow only picture, because every country has a little bit different, and we did see that there was like differences in the countries. Like in some, even the countries are more equipped with the public transportation versus personal transportation. We did see some influence in the Europe, for example, that the people were scared to use the public transportation to get the COVID. So they were using more cars, personal cars, to move around and so on. So I think it is very important issue that it should be locally studied, and all this somehow do. I think that what Yasin was also mentioning, the COVID has some positive impact on the life. So it was not only negative, something like moving to the internet, online, the work, hybrid type of the meetings or conferences, even educational online. We need to remember still that the social interaction is incredibly important for the mental health. So how to do it more efficiently and still not forget that we need to meet sometimes, right? And some other people, that not only to move to the online interaction is also incredibly important. So there are many of the lessons what we should learn from the situation, pandemic, in the traffic, but also other, the life related to pandemic.
I really enjoyed this conversation. I have to say, Michael, it must be fun to work with Yasin too, because at various moments he said, if we only had more data about this, if we only had more data, he's hungry for more data, which I appreciate. And to understand the nuances of this, again, I really want to underscore the point that you were just making, Michael. We talk about this pandemic as a global phenomenon, but you have uncovered in these papers some quite important local contours. And so, yes, it's a global phenomenon, but it's demonstrating all kinds of really important social behaviors, technological, infrastructural realities, and public policy realities around the world. I just want to remind folks that you've been listening to COVID Calls, and you can usually catch COVID Calls at 7 p.m. Eastern Time. Please join my COVID Calls discussion at 6 p.m. Friday, East Coast time, when I'll be talking to poet Kathleen Ossip. So please join me for that. And I want to once again thank my guests, Yasin Jamal Yasin and Michael Grivna for your fantastic work. You've taken my very low level of knowledge and moved it up a notch in just an hour. I really appreciate that. And thanks for the work you're doing. Keep it up.
Thank you so much.
Stay healthy, everyone. We'll see you next time on COVID Calls.
Thank you so much.